Hi viewers, good evening. Welcome to today's episode of KIMSHEALTH Dr. Live. Myself Kripa Rajiv. Health is wealth. We are taking tiny steps to build a better health. Today in this episode we have taken the topic common ENT problems. To talk more about this topic, we are having an efficient doctor with us. He is having 12 years experience in ENT. He is working as an ENT specialist in KIMSHEALTH Medical Center, Mohara. It's my pleasure and privilege to welcome Dr. Pradeep Divakar to the show. Hi doctor,
Hi,
welcome to the show.
Thank you.
How are you doctor?
I'm good. How are you?
Yeah, I'm good, thank you. Can we move ahead with the discussion?
Yeah, definitely.
Doctor, in your this much experience, you have noticed so many ENT problems. Can you please list out the common ENT problems that you have noticed in Bahrain?
If I say about my experience in Bahrain for the last 8 years, as a specialist ENT, the nasal symptoms like the nose block, nasal congestion, stuffiness, and these kind of symptoms are more common compared to the ear and throat problems. My observation to this are mainly the weather. Bahrain is very beautiful and is the happiest among the Arab countries, but we have very unsettled weather often. And this dusty weather is the main reasons to get the nose problems. So the weather is the main reasons to get the nose problems compared to the ear and throat issues. Other one which I notice is smoking. Here the smoking is very common. Using the normal cigarette, the shisha and the electronic cigarettes makes the people more vulnerable to nasal allergies. Kids are also victims of the smoking because their parents smokes in their house, they are forced to become passive smoking. So the kids will be symptomatic in their younger age group. Other reason is the use of perfumes. Even though you feel it's very silly, but it's fact. It's a traditional, the Arab people are very fond of these perfumes, even though it smells good, but it causes so many nasal allergies. And third is again the traditional part of the Arabs, they use the burning of incense. In Arabic they call it as bukhur. So it smells very pleasant in your home, but it's very dangerous. It not only causes nasal symptoms, but also it's not dangerous for your lungs. Other one which I observe is the pets. Pets, people in Bahrain are fond of these pets, either birds, cats or dogs. Being this very high, humid and hot weather here, most of the time the pets we are forced to keep inside. So these pets also a reason for the nasal symptoms. Considering all these factors, I am talking for the last 8 years experience in Bahrain, I can say among all the three, ear, nose and throat, I feel the nasal symptoms are more common.
Next common thing what we have noticed is tonsils infection. Everyone might have infected at least once in their life when it is needed to be operated.
Talking about tonsillitis is one of the most common infections, mainly comes to the school going age group, 5 to 15 years. Tonsils are nothing but the lymphoid tissues, two ball-like structures inside your throat. Its main function is the protection of our body, but sometimes it gets infected, especially in the school going age group. About 15 to 30% of the sore throat in kids are due to bacterial tonsillitis, and 5 to 10% of in adult sore throat also due to bacterial tonsillitis. Tonsils get infected by either bacteria or virus. So the bacterial tonsillitis cause more symptoms than the virus. How you treat it? We treat it medically and surgically. The question here is when to operate on tonsils. If you have a single or 2 episodes of tonsillitis, it is not required to get operated. Tonsil surgery is called tonsillectomy. Tonsillectomy has its own guidelines to get operated. Recurrent tonsil infections. Recurrent means you are keep on getting the infections. The guideline says if you are getting a significant 7 or more infections in a year, or you you have significant 5 episodes of a throat infection for a consecutive 2 years, you can go with the tonsil surgery. Or else absence of school days more than 2 weeks or loss of your office days for more than 2 weeks, definitely go for a surgery. And once infection you cannot control it, the tonsils may get into called as tonsillar abscess. Once you got the tonsil abscess, it's need to get removed, because the second attack of a tonsil abscess is a clear indication of tonsil surgery. Another one is abnormally enlarged tonsils can cause sleep problems, snoring, bad breath, and sometimes difficulty with swallowing. This has to be considered for tonsil surgeries. An abnormally tonsil showing any features suspicious of a cancer has to be operated. These are the real guidelines to get it operated. Not all the tonsil infections need not to be get operated. So the thing is, if you have any doubt regarding this tonsillitis and tonsil surgery, get checked with the ENT doctor and assess the criteria whether you belongs to get it operated or not.
Doctor, I have a doubt regarding this. Once if it is operated, is there any chance that it will come again, tonsils?
Definitely, tonsils once operated will never come back.
Okay.
That is a misconception actually.
Okay, fine. Now, the common word that we heard from all the ENT doctors is nasal septum, deviated nasal septum or deviated nose. Is it necessary that we have to operate the deviated nose condition?
I am sure about anyone consulted any ENT doctor with any nose problems, they might have experienced the word deviated nasal septum. Nasal septum is nothing but a septum which divides the nose into left and right. Instead of being in the center, either it can be deviated to the left or right. It does not mean that you go and get it corrected. Again, there are certain guidelines to operate on deviated nasal septum. Let us see what are the reasons to, what are the causes for a deviated nasal septum. Mainly trauma is the cause of deviated nasal septum, either a birth trauma or a road traffic accident, an assault or a sports injury. It is not properly corrected, your nose becomes crooked. Whether to operate or not, that is another the question you ask. To operate on a deviated nasal septum has a certain criteria. A symptomatic deviated septum is the only thing you need to get operated. What is the symptoms? Symptoms, a nasal obstruction, a nasal block caused by a deviation has to be operated. A patient with a severe headache that resulting from the deviated septum touching on the lateral wall of the nose, which impinging on the nerves, that cause severe headache, that has to be operated. It will never cure with a medicine. Third one is called the bleeding from the nose or epistaxis. Because it is a deviated nose, it can cause one side obstruction, other side very roomy. The roomy side airflow will be more the air currents becomes crusty. When the crust comes, the chance for the bleeding comes. And the deviated side also the blood vessels are stretching. It is also reason for the bleeding from the nose. So it is a bleeding from the nose, this is one reason. If that is the reason, has to be operated. Another issue, uncontrolled sinusitis. Because of the deviation, it causes an impaired ventilation to the side of the sinus. So that causes a permanent sinus infection that need to be operated. So these are the things, these are the conditions a deviated nasal septum to be operated. Otherwise, your nose is slightly left or right, does not need to get operated. So to get a proper examination, see an ENT doctor, get checked, and now there are nasal endoscopy, CT scan, all the investigations are available. So, so the doctor will definitely tell whether you get operated or not.
Doctor, coming to the point, nowadays it's a common thing that we used to clean our ears with buds in home itself. Is it required? What is your opinion about that particular topic?
Cleaning ear is a very commonly asked question in my clinic and all the people, and people are so obsessed with the cleaning ears. So what we are cleaning is something called as wax or shama in Arabic. So what is wax? Wax is nothing but is a secretion of our sebaceous and ceruminous glands that mix with our dead skin and entrapped debris and some dust. Is it a protective mechanism for our ears? It has a lubricating effect on the ear canal. It's pH that prevents the growth of bacteria and fungus, and to some extent it entraps a small organism, even dust, that enter into the deep of the canal. So these things no need to be removed. Then when it's need to be removed, it becomes symptomatic, especially those people who are sweating a lot or those who are working outdoors. So that people, and some people the ear canal is very narrow, some very tortuous. These people, the wax is getting impacted, causing problem like the ear pain, ear obstruction, hard of hearing, ringing in ears. This has to be removed. If you try to remove by yourself, you are not removing it actually. You are just pushing inside. We are doing it blindly. So that causes trauma to the ear canal, that resulting in a further infection. And you are pushing deep to the ear canal makes further difficulty in removing later on. And by chance, it's all the chance to get traumatize your eardrum also.
Doctor, another most common complaints that people worried is the change in the voice. Is it a real matter of concern, and when we need to take a medical advice?
That's a very important question. Actually, the voice is unique for each and everyone. Each and every individual has a characteristic voice. A change in voice has to be taken into a concern. The voice changes happens infections of the larynx or voice box, commonly either by a bacterial infection or a viral infection, or simply you are shouting or screaming can change your voice. A person with a severe gastric reflux called gastroesophageal reflux disease can present with a change in voice, or any problems of the larynx like a vocal cord nodule, vocal cord polyp, or malignancy or cancer of the larynx can present with a change in voice. There are certain conditions of the lungs and even heart also can present with a change in voice. So it's really need to be taken care or into a concern when if the persistent more than 2 weeks, if your change in voice or hoarseness has to be taken care if it's not recovered within 2 weeks, especially in person above 40 years and those who are smokers, should exclude the possibility of the cancer or malignancy. Okay. So how you will evaluate is a very simple method, because these areas nobody can visualize normally. So nowadays very sophisticated flexible endoscope available. You can do it in our ENT clinic without any pain. This will visualize all the area of the larynx. Even some case we can even take a biopsy through it also. This is very important. And how to evaluate a change in voice is very easy. In ENT clinic we have very sophisticated flexible laryngeal scope available. You can do it in an outpatient procedure without any pain. It's clearly visualize all areas of the larynx. That is the most important and sophisticated diagnostic technique for the larynx. And if it's needed, you can go for a CT scan chest and cardiac evaluation for further. So any change in voice which persists more than 2 weeks has to be evaluated. You have to consult an ENT doctor and get checked.
Okay. Now nowadays the most common problem is headache. Every person will be having headache one or another day. Does it have any relation with ENT?
Definitely, the headache is a vast subject actually, and start with our tension headache, with the vascular headache, headache from the sinus. There are a lot of causes, neurological problems, brain problems like brain aneurysm, brain tumor. These all present with headache. So headache is not a disease actually, it's a symptom. You have to find out what makes you the headache. As an ENT specialist, I am here concerned mainly about the nose and sinus issue and vascular headache taken into consideration, because sinus is the one thing which makes you the headache. So you have to consult an ENT doctor to exclude the other possibility that causes the headache, and to do a nasal endoscopy, if needed a CT scan, to rule out the sinus issues, and to after rule out all the issues, if it's needed, you can treat the vascular headache. It may take some medications and lifestyle modifications. If that is not a reason, you have to search for other reasons that make you headache. So headache, if the frequency and the severity of the headache, if you notice it's changing, definitely you have to seek a medical attention.
Another scary situation is bleeding nose. Nowadays it's a common thing. Even in child we can notice a bleeding nose. Can you please explain the cause and what we have to do at the time of that bleeding? Immediately we cannot take them to a medical center. At that moment what we should do?
Yeah, it's bleeding from nose is a really scary situation. It can affect all age groups, and if you look at the cause for the bleeding nose, you can start with the trauma. Any kind of trauma, a hit on your nose, a fall on your nose, and road traffic accidents, anything can present with a bleeding nose. No need to be a trauma by a hard blow. Even a forceful sneezing can come present as a bleeding. The medical term used is called epistaxis. And there are certain other conditions that present with a bleeding nose, like the conditions of the nose like papilloma, hemangioma, inverted papilloma, and deviated nasal septum, as I explained before, and high blood pressure. So very commonly patient present with old age, present with a nasal bleed, nothing but is high blood pressure, and uncontrolled kidney diseases and liver diseases and blood cancers. You might have seen in films and everything, you know, there's blood coming from the nose. So these are the conditions. It actually a sign. Underlying pathology has to be found out. So it's only a sign. You need to find out what makes the nose bleeds. Okay. The another question you ask, how to control it in a setup, normal setup. So you cannot rush into hospital immediately. So this is a medically called Trotter's method. Actually, it's nothing but you just lean forward, pinch your nose and breathe through the mouth. So you should not lean back, so the blood will go into your throat. So you should not you should pinch the nose minimum of 5 minutes, and you can apply ice on your forehead, on your cheek, over the dorsum of the nose, and by the time you should seek medical attention. And once you reach in the hospital, the ENT people has to do examine in detail, including a diagnostic nasal endoscopy. If they can find out a bleeding point, they can do cauterize the bleeding vessel. There are methods like chemical cautery and electrocautery. Sometimes if they cannot control, they can do something called anterior nasal packing to control the bleeding. So these are the measures to control the bleeding, but the actual reason behind to get a nasal bleed has to be evaluated. So don't take it as a silly thing. You should evaluate it. There may be some underlying serious pathology behind the bleeding nose. So if you have a multiple episodes, even a single serious episode of bleeding, you have to consult an ENT doctor and get checked.
Doctor, in earlier days, the term hearing problems will be hearing mostly to one after a particular age group, right? I'm not telling everyone, but mostly. But nowadays, it's common even in youngsters. Can you please tell us what is the main cause for that one?
Hearing loss is a vast subject to be discussed. Now I will discuss something more specific about the hearing loss, what is happened with the youngsters. The new advent of this new MP3 players, the use of the mobiles and these younger generations are using it for a long time. And less than 35 years of age group are using these gadgets for a long time. That is the main reason for a hearing loss. How you feel like you have a hearing loss? That is very important. Sometimes you yourself feel that I cannot hear properly. Sometimes your friends or colleagues or your family members says that you are not listening what I am saying. So in that situation you have to check for hearing. Actually there is something called pure tone audiogram. It is a test. It will clearly tell whether you have a hearing loss, and what percent hearing loss and what type of hearing loss. So what is the treatment for a hearing loss which happen with the use of headphones? Sadly there is no treatment. Only the prevention is the only thing we can do it. So how, as a rule, you are not supposed to increase the volume more than 60% of your gadgets, and you should not use it at a stretch of more than 60 minutes per day. So only prevention is the only cure. So once it lost, instead of using the headphones, you have to wear for a hearing aid. So just think about it before using it.
Doctor, mouth breathing and snoring are the most common problems nowadays seen in kids. Can you please explain the reason for that one?
A lot of kids are coming with snoring or mouth breathing. So any conditions that affects a nose problem like allergic rhinitis, any turbinate hypertrophy, deviated nasal septum, or cause a defective nasal breathing, obviously open the mouth and they will breathe through the mouth and ultimately become snoring. So I am talking more about something significant cause for the mouth breathing here. This is called adenoid hypertrophy. Adenoids are similar kind of lymphoid tissues like tonsils, but they are located deep inside the nose, and these lymphoid tissues are get enlarged because of the persistent infections of the nose, sinus, rhinitis, or it get enlarged. So what happens, it is difficult to get breathe. This kid present with always a stuffy runny nose, bleeding from a nose, and sometimes the kids cannot hear properly. It will affects the medullary function, and it is called chronic mucoid otitis media. It caused because of the water get entrapped in the middle ear, and it is a late sequelae of the adenoid hypertrophy. So any kids which is snoring for a long time has to be evaluated. Otherwise it can cause into serious problems like hearing problem unless it is not checked for it. So how you diagnose it? A simple X-ray can diagnose an adenoid hypertrophy, or if the child is so much cooperative you can go for an endoscopy. So we treat it. How you treat it? You can treat it medically, control the nasal allergy, nasal decongestant, cause of antibiotics, nasal sprays, and you are looking for the regression of the symptoms. If the child is not responding, we can go for a surgery called adenoidectomy. So snoring has to be evaluated properly. Any kids which they have a snoring has to be checked with an ENT doctor whether it need to be removed or not.
Doctor, dizziness and vertigo is another complaint that's nowadays it's most common in many people. What is the, in terms of ENT, what is the reason for that?
Yeah, dizziness, unsteadiness or vertigo is a common problem is coming into the ENT. It's a really a panicky situation to everyone. Once you cannot imagine a state where you cannot stand properly. So there are again a lot of reasons to make a person dizzy or unsteadiness. If I look at all these symptoms, it's very difficult to discuss here. I will tell about the ear balance problem. Everyone comes to know or might have heard about the ear balance problem that causes vertigo. So this is a condition called benign paroxysmal positional vertigo. Actually the balancing mechanism is in the inner ear, in the semicircular canal. There is a crystals which is misplaced that causes this condition. We can differentiate it from other conditions like this vertigo is really a violent vertigo. it happens with the change in your head positions, and it is so bad that sometimes you may vomit, and you will get the same vertigo even you lie down, and gets aggravated even in turning here and there. So how to diagnose this condition? Again, to just saying it is because of this ear balance issue, you have to always think about the other neurological condition that makes a person dizzy. So get checked with the ENT, and there are easy diagnostic tests, clinical tests like Dix-Hallpay maneuver. You can do it in a ENT clinical OPD, can diagnose a vertigo, BPPV or ear balance problem, and there is something called Epley's reposition maneuver, that is a treatment modality. And these are the main things of the management of the vertigo that comes from the ENT side. Of course, there is something called beta-histine tablet has to taken, and this called a vestibular rehabilitation exercise. This another thing has to be continued for a long time. But remember, I am talking only about the ENT causes. There are so many dangerous things behind a dizziness or a vertigo that should be taken into your consideration, and before going into a judgment you have to consult the doctor before a conclusion.
As well as nowadays foreign bodies in ENT areas is a scary situation, especially when it comes to kids. What is your opinion about that area?
Yeah, foreign bodies in ENT is always an emergency to us. Actually, so I will just divide this into ear, nose and throat foreign bodies. If an ear foreign bodies, again we can divide into those who are living foreign bodies and non-living foreign bodies. You might have heard somebody's ant goes in, some insects, cockroaches. Yeah. It's a very scary situation. It's very painful and so much irritating. You are not supposed to, you are not attempt to remove the insect when they are alive. You should make them, you should kill them actually. You can put some oil or little bit water in the home setup actually. If you put the oil, advantage is if an insect, it clogs the wings and it easily dies. And the next day you can go to the doctor and get it removed. The non-living things are especially seen in kids. They will put like the piece of pencil, paper, thermocol, beads, everything. The only advice from my side is should never attempt to remove, because here is a blind end and the last is a eardrum. Once you cannot remove it, you are pushing it deep inside, and once you go deep inside, then the removal needs to be under general anesthesia. So in these situations, don't attempt to from your side, just seek a ENT help. Another one is the nose, very commonly seen in kids. Kids are in a particular age group, 3 to 5 is very commonly they put these foreign bodies, like again the piece of paper, thermocols, vegetative matters. These are very commonly put. The very dangerous things nowadays we come across is putting the button batteries, like you are putting in the watch and toys. So once inside the body, it start leaking the chemicals. It causes a chemical burn on these very delicate areas. So if it's a battery, it has to be removed immediately. Again, don't try to attempt to remove it. Why? Because as far as it's remain in the nose, it's safe. If you attempt it, it's a very non-cooperative kids. If you pushed it in the back, it just go back to the lungs, and you know how dangerous it is. So the nose foreign bodies should never attempt in your home, always in a hospital setup. And coming to the throat foreign bodies are common in whether it's from all age group. So most commonly chicken bones, fish bone, these are commonly come across. Most of the time we can, fish bones we can find a tonsil, we can remove it. If something, and most of the time people have a feeling, it might have gone inside, but they have a feeling that the foreign body is stuck inside. So we need to get checked. As I mentioned earlier, there are very sophisticated flexible endoscopies are available. So you can put the scope and see everything inside. There are X-ray. If you are apprehensive, you can take an X-ray. In case you can go for a CT scan. If there is inside the foreign body struck, only thing we can remove under general anesthesia. So these are in general the foreign bodies in the ENTs.
So, doctor, I guess we have covered almost all the queries related to our topic, most common ENT problems. Thanks a lot, doctor. Thank you for coming here and answering all our queries. Can you please give a takeaway message to our viewers?
Definitely, if ENT specialty is concerned, I think I have discussed the most of the common symptoms you come across. The most important thing is whether it's a foreign body, whether it's a headache, whether it's a bleeding, whether it's a change in voice, but you should not attempt yourself or you should not self-treat it. You should just seek a medical attention and get evaluated further. There are so many dangerous reasons behind simple symptoms. So, you should always check with an ENT doctor before reaching into a conclusion.
Once again, thanks a lot, doctor, for joining with us. For any ENT needs, you can contact Dr. Pradeep. He will be available at KIMSHEALTH Medical Center, Moharek. Doctor, can you please explain your duty timings to the viewers?
I will be available in KIMS Moharek branch from 9 o'clock till 1 p.m. Then my next evening schedule will be 5 p.m. till 9 p.m.
Okay. So, I'll be back with yet another doctor, same day, same time. Until it is Kripa Rajiv signing off from KIMSHEALTH Dr. Live. Take care and bye-bye.